That's why it looks like the cytoplasm looks real thick here, because this tissue will stretch. So when the bladder fills up with urine, but yet you don't want these cells to tear apart from each other. So it looks like they have a tougher membrane up top. And to me, that's going to be one of the main identifying characteristics of transitional epithelium.
So if they stretch, they sort of look squeamish, I guess?
A little more, they won't stretch that much. They'll probably look less flattened out. They'll probably look kind of cuboidal, but further apart. But again, the best identifying thing to me is to look for these big borders along the free edge. Because you could interpret this in a number of ways. But that will be the tip off. Okay. Now, as we look at the epithelium, I also want you to notice that there is hardly any space between the cell membrane of one cell and the next cell. All right, in all of the epithelial cases, the cells look very, very close together. All right, here's another example. Okay. Now, the shape of the nuclei look like, this is a tissue, it takes up stain. All right, this is not stained, so this is free space. So, how many layers do we have between the free space? You don't even see a basement membrane.
Wow.
All right, so this is just one layer. So this would be simple epithelium. And if you look at the shape of the nuclei, they look like they've been flat.
Squamous.
All right, so that would be simple squamous. It would not be one of the tissues that you would have to identify. If you did a cheek smear, where you take a blunt toothpick, scrape the inside of your jaw, and then spread that onto a slide, stain it, and look at it under the scope, then you would see separate flattened cells, because you're really scraping off the top layer of flat cells. But you won't have to identify simple squamous. I put on the board the 5 types of epithelial tissues that you do have to identify. I think that included simple cuboidal,
Cuboidal, simple columnar, stratified squamous, stratified ciliated columnar, and transitional.
Pseudo-stratified ciliated columnar, and transitional. So those were the 5 types of epithelium that you're going to have to identify. All right. So everybody's familiar with this one. Under your microscopes, this is at a higher power magnification than what you will see in your scopes. This is greater than 400x. So that it's important that you look at everything at 400x, because that's what you're going to see on the lab practice. Okay, you can see why this is simple cuboidal. Basement membrane, free space, one layer of cells, what shape? Relatively round, almost centrally located nucleus. This is sort of, it looks like it's in transition, this cell. But that cell, the nucleus is more centered, these are more centered. So this would be simple cuboidal epithelium. All right, this one was like the transitional in that you had some big cells up here, but the experts had to tell us that this cell reaches all the way down to the basement membrane here. These cells are just in front of it, down here. You can see the brush border. You will barely see the brush border at 400x, but it will be there. All right, how would you identify this tissue? This tissue right in here.
Columnar.
Exactly. Simple columnar. All right, everybody got that one? Here's the free space, here's the basement membrane. All right. Is this the base or the apex of these cells?
Which part? Which part?
Is this part the base or is this the apex of all of these cells?
Apex.
Apex, okay. That's why we didn't say bottom versus top. Because these cells are kind of upside down. They're the same cells as these. And so where would be the base? Down here. Where would be the apex? Here. Where would be the base?
The part where the
Where would be
nucleus
the
is.
apex? All right, so that's why we didn't say top. Here's the top of these cells, here's the top of those cells. And the bottom would be down here. That's confusing. All right, now let's move on to the next tissue. Again, before we move on from epithelium, again, notice how tightly spaced the individual cells are. There's hardly any room between the cells, hardly any extracellular material between the cells. Okay? Now, the next category of cells that we're going to look at will be connective tissue. Next category of tissues that we're going to look at will be different kinds of connective tissues. So one of the main identifying characteristics of connective tissue that's going to indicate to you that you're not looking at epithelium will be tissue spacing, or the spacing between cells. You saw how close the nuclei were in epithelial tissues. Well, look how far apart these nuclei are, okay? And they're different types. Well, this is an embryonic type of tissue. There's embryonic connective tissue that comes from mesoderm. One type is mesenchyme. Mesenchyme is like a stem cell that gives rise to other kinds of connective tissue. So you find this in embryos, but you also find Wharton's jelly. Wharton's jelly is a type of connective tissue, embryonic connective tissue too. Like, I'll get through to it in a second. But in the baby's umbilical cord, the umbilical cord is kind of, you can feel that it kind of has a jelly inside. And that keeps the cord from kinking up as the baby does flips and things. Okay, it won't, the cord won't wrap around and kind of choke because of this jelly. So that Wharton's jelly is also one of the two types of embryonic connective tissues, which we're not going to study. Mesenchyme gives rise to adult connective tissues.